Hello, my name is Sarah. I'm one of the midwives here at St George's Hospital. I'd like to welcome you to our antenatal education classes. We hope that these short videos will help answer some of the questions that you may have about pain relief, labour and what happens when you have your baby. We hope that these short videos will help assist you in making your birth preference choices. This usually happens when you're around 36 weeks. Please speak to your community midwife for further details.
Hi, I'm Dora, one of the midwives at St George's. Today we will go through the different stage of labour. So we will talk about early labour, and what happens when you will have your baby. I would like to start this session with ice-breaking game. You can play this with your partner, with your friend and with your family at home. You will see some cards and you can try to put them in the right order and then we can go through together. The words you can see on your screen are different elements of early labour, and birth of your baby. You can try to put them in the right order and then we will go through together. Well done. Now we can go through the order together. So as first card you see here the mucus plug. So you might see your mucus plug a couple of weeks before you go into labour or a few days before you go into labour. You might see a little bit of pinkish colour with it and it's very normal. If you have any concern, you know that you can always call us. The second card is period cramping. So you might start to experience some period cramping couple of days before your body will actually go into labor. Before that, you can also experience some tightenings. You will be just aware that the tightening's there and it shouldn't be painful at the beginning. This stage is called early labor. Some women feel this stage has a very long and intense few days. This is very normal. You will start to experience some tightenings and slowly this tightening will become a sort of period cramping. If you are experiencing that, again, you can always call us for advice. Then we've got regular painful contraction, unable to talk through. Usually when you reach this stage and you start to experiencing regular painful contraction that last around 60 seconds and they are coming around 2.5 minutes, one from the other, we usually advise to call us and we will ask you a few questions and we will invite you in for an assessment. It's very normal in labor to experiencing vomiting and nausea and feel quite tired. When you will come in the hospital, we will assess you and if your contraction will be regular, intense and strong, we will offer you an internal examination to see if you are in labor. As the labor progresses, the contraction should be always regular. It's very normal to feel tired in labor. There's nothing to be worried. You will still be able to go through and to have your baby with you. As the labor progresses and you will arrive to a fully dilation, you might start to experience a sort of urge to open the bowels and urge to push. This is very normal. It's the head of your baby pressing the very last part of your back passage. It's very normal if you feel you want to open your bowels. I don't want you to feel afraid. It happens most of the time, and as a midwife we are very happy when you tell us that you want to open your bowels, because it means that you will meet your baby very soon. As last three cards, we've got birth of your baby, skin to skin and the birth of the placenta. When your baby will be born, we will offer you to do skin to skin with your baby to maintain the baby temperature, the heart rate and the respiration. Well done for finishing the game. So now you will go through a bit more deeply through all of the stages of labor with my lovely colleague. They will be with you for the next couple of minutes.
My name's Laura, I'm a midwife at St George's Hospital and I'm based on the birth centre but also work on delivery suite, so plenty of places that I might see when you come in to have your baby. So following on from what Dora's already said about that early phase of labour, which you might also be referred to as the latent phase, that's the time when you're often at home and it's really normal for that phase, as Dora said, to take 1, 2, 3 days. So it often starts like period cramps and then gradually evolves from there. It might be that you start to get those cramping-like sensations and they get quite regular, quite close together, and then it all goes away again. That's really normal. That just means your body is probably not quite ready yet, in which case we say just to rest. It's really important in this time at home to try and stay nice and calm and relax. That will allow oxytocin to flow, which will then in turn make your contractions more regular. Anything that's going to make you stressed, uncomfortable, tense will increase your adrenaline, which will reduce the oxytocin. So it's really important to consider all the ways that you can try and stay calm and relaxed at home in that time. In those early stages at home, some might be 10 seconds long, some might be 30. You might get different gaps in between those contractions. But when your body is ready, they will all be as long and as strong as each other and more uniform. Eventually, your contractions are going to get stronger and regular. And what we mean by regular is every 2 to 3 minutes, lasting at least 40 to 50 seconds, and all as long and strong as each other. It's also important to remember that your baby is encased within a big amniotic sac full of fluid, and that could break or pop or burst. You might hear different things said at any time. It could be before any contractions start, it could be when you're at home and you've got those period-like cramps, or it could be when you're in hospital, perhaps just before your baby's about to be born. So we would speak to you on the phone, and either when you feel that you need to come in or when we assess that you're ready to come in, with those regular contractions that we spoke about. When you get to the hospital, we will assess you, and that will be on our birth centre if that's where you've chosen to have your baby, or on the delivery suite triage. And this assessment will include checking your blood pressure, dipping your urine, feeling your tummy, listening to your baby's heartbeat. And if we deem necessary, or if it's something that you choose to have, we would offer you an internal vaginal examination. And this examination tells us what your cervix is like, not only how open and how dilated, but whether it's getting nice and thin and soft, and where the position of it is. We know from the evidence base and that research has been undertaken that established labour is known to be when your cervix is more than 5 centimetres or more open, with good, strong, regular, coordinate surges and contractions. And by that we mean that you need to be having these surges every 2 to 3 minutes to really open up your cervix. With your first baby, it's really common that you might have had those surges every 2 minutes for perhaps an hour or two, and then your cervix might not be 5 centimetres dilated yet. That's really normal, because with your first baby, we know that you might need quite a few hours of those regular surges to really open up your cervix. You will obviously have a discussion with your midwife for when you feel that it's the right time for you to stay in. And when that happens, we will admit you to one of our birthing rooms. All of the pain relief options will be available to you, and that's between the birth centre and delivery suite. It's really important that you stay in contact with us and let us know what's happening, especially if this isn't your first baby. If it's your second, third or fourth baby, we know that your cervix can change quite quickly, so it's important that you stay in contact with us and you come into hospital at the right time. Click the links above to see more information about all the pain relief options that we are available to you. We know that everybody is different, so everyone's length of labour will be different, but with your first baby, the evidence does suggest that an average length of labour once you've been admitted in established labour would be 12 hours, which would be very normal. After some hours of this first stage of labour, your body will start to prepare for the second stage of labour. And that's when there's no cervix left around your baby's head, nothing can be felt. And your baby gets much lower within this stage, and that's why lots of ladies feel pressure in their bottom. They feel like they might want to open their bowels, and that's literally because your baby's head is compressing on your rectum, so it's really normal. It's a really positive sign. It means your baby's coming nice and low. Naturally, over time, this pressure will just build up, and there will then become a point where your body naturally starts to just go with that urge and bear down and kind of push your baby and go with that feeling of the pressure. Lots of ladies worry that at this point they won't have the energy to push, but it's a kind of a natural sensation that you won't be able to fight against, because your body will naturally do it for you, so it's nothing to worry about. As you go through those stages of labour, your baby's naturally going to come down further into your pelvis. As you become fully dilated, your baby gets extremely low into the pelvis, and as you start to have those urges to push, you might feel that your baby's head comes down and then rocks back. This is really normal because your pelvis is a curve and it takes time for your baby to navigate that curve. There will become a point when your baby has navigated the curve of your pelvis and your baby's head stops rocking back in between. At this point, it might be that your midwife can see your baby's head. With your first baby, it's really common that this pushing stage can take 1 to 2 hours, and that's because your baby has to navigate this curve of your pelvis and we want everything to just slowly open up. Lots of ladies are worried with their first baby about episiotomies and having some form of tear to their perineum. We know that it's very common with your first baby for this to happen. Episiotomies are not something that we would do routinely with normal vaginal birth. However, sometimes they are indicated, in which case this would be discussed before it happens. It's not something we would ever do without your consent. We will always put your baby skin to skin, and we will always do delayed cord clamping. The only time that would differ is if we needed to give your baby any support with their breathing before they were born, in which we would anticipate. Sometimes your baby is born in theatres, in which case we still try and facilitate skin to skin and lots of time with your baby. The evidence for delayed cord clamping shows that it's really beneficial to both yourself and your baby, and this is something that we will routinely practice. Once your baby's born, you need to give birth to a placenta, and there's 2 ways as to how this can happen. The first way is your placenta comes naturally, and that means that we don't give you any medication, no drugs, and this can happen over the period of an hour, but it's often much less. The other way in which your placenta could be birthed would be by something what we call active third stage, and it might be recommended by your midwife for lots of different reasons, and that could be, for example, if you're induced. This would involve us giving you an injection into your leg a few minutes after your baby's born, and this makes the placenta detach from the uterus much quicker, and your midwife will guide the placenta out for you. Now that your placenta's born, it's really important that your midwife checks your perineum to see if any repair is recommended. If it is, we would aim to do this quite imminently within the first 1 to 2 hours after your baby is born. We would aim to keep you in the room where you've just given birth to your baby for approximately maybe 3 or 4 hours, depending on where you give birth. Some ladies will be able to go home several hours after the baby's born, and some ladies will be recommended to stay overnight with their baby, and that could be for a number of different reasons. If we do recommend that you should stay overnight, we will transfer you to Gwilym ward, which is our postnatal ward, and your baby will stay with you at all times. For more information about what happens when it's time to go home and after you get home, click the link above. I hope that's been really helpful and has answered lots of your questions. Any other questions, then please ask your community midwife, and we really look forward to seeing you when you come in to have your baby.
Okay, my love, well, if you need me, call your call bell and I'll come right away. Hi, my name's Grace. I'm one of the midwives at St George's, and today I'm going to talk to you about induction of labour. Okay, so let's begin. Some of you might be asking, well, what is induction of labour? Induction of labour is usually one that is started artificially, mostly by medical means. It's fairly common for you to have a labour that's induced. Every year in the UK, at least 1 in 5 women have an induction of labour. Commonly, at your 40-week appointment, this is when your midwife will talk to you about induction of labour if you need one, or if you have a high-risk pregnancy or things change throughout the course of your pregnancy, then you might find that these discussions start earlier. If it is recommended for you to have an induction of labour, you will get an opportunity towards the end of your pregnancy to discuss this with consultants, doctors and your midwife. Commonly, the 40-week appointment with your midwife is when you will have discussions about your options, and your midwife will talk you through the process of induction of labour. There are lots of different reasons why you may need to be induced. Here are the different reasons coming up on the screen. Induction of labour is indicated when the benefits of birth for the mother and the fetus outweigh the benefits of continuing on with the pregnancy. There are various different methods that we use to induce your labour. Here at St George's, we most commonly use a vaginal pessary called Propess. The Propess is a slow-releasing hormone used over a 24-hour period with the aim to hopefully help your body to try to start the process of labour. On the day of your induction, you'll come into hospital.
Some women can be induced on the antenatal ward and some women are induced on delivery suite. When you meet your midwife, she'll introduce herself and she'll take you to one of the beds in the bay. This will probably be shortly followed by a doctor who comes to see you, and they will both make an initial assessment of you. They will also do a monitoring of the baby to make sure that you're both safe to start the induction process. So as soon as both you and your midwife are ready to start the induction process, your midwife will first offer you an internal vaginal examination, and this is mainly to assess the cervix and its position. Quite commonly, when it's your first baby, the cervix is a long, firm, thick muscle that sits quite posteriorly within the vaginal wall. So the ProPes is a slow releasing vaginal pessary which often looks like a really small tampon, and once the midwife has performed the initial examination, she will then insert the ProPes behind the cervix. If this examination is something that you feel anxious about, please talk to your midwife before the procedure starts, and she can talk to you and try to give you the support that you need. So once the ProPes is in place, we recommend that both you and the baby have at least 60 minutes of monitoring so that we can observe fetal well-being. Once the monitoring is complete and we've established that everything is well, we really encourage you to mobilise around the ward. We've got lots of different equipment that you can use on the antenatal ward and delivery suite. For instance, we've got bean bags and we've got birthing balls like this one. Ta-da! So over the next 24 hours, we will regularly monitor both you and the baby, and if at any point we have any concerns about your well-being or the baby's well-being, we'll act accordingly, and sometimes this means actually taking the ProPes out and observing contractions. Providing that everything is well, once the ProPes has been in for 24 hours, your midwife will offer you another vaginal examination to reassess the cervix. This assessment will be done using the Bishop score. Hang on guys, let me just give this ball back. So the Bishop score is commonly used to assess the cervix, and a high Bishop score is normally associated with an easier and sometimes shorter induction of labour. However, your midwife may establish that your Bishop score is on the lower side, and she might say to you that you could possibly benefit from another cycle of ProPes. So this would mean a further 24 hours, a new ProPes and continued monitoring. At this point, I would like to point out that it's probably more likely that you will need a second cycle of ProPes. If it has been recommended that you need a second cycle of ProPes, please don't be disheartened. It's very common for this to happen, especially if it's your first baby, and it's really important to remember that we are artificially inducing your labour, so it can take a number of days, sometimes 48 hours, for your body to react to the ProPes. If your midwife establishes that your cervix is favourable and you have a high Bishop score, it may be that at this point we can artificially break your waters. If your midwife feels like we can do this, we will move you from a bed in the bay to a room on delivery suite when one is available, and your midwife will talk you through the next steps. You may have heard that induction of labour is a really long process, but it's really important that you stay as positive as you can, and do all the things that we've been speaking about, so keeping yourself really mobile, keeping yourself hydrated, making sure you're eating and drinking. It's really also important that you keep your space as comfortable as you can, whatever it is that makes you feel comfortable. Because the process is such a long process, you may find that you don't sleep very much. There are various different methods of pain relief that we can offer you throughout the induction process, and if you feel like you need some pain relief, then please speak to your midwife so that she can support you through the process. Most commonly, you'll have your induction on the antenatal ward. If you have a high risk pregnancy, it might be safer for us to start your induction on the delivery suite, but here at St George's we also offer an outpatient induction and labour service which you can have at home. If you think that you would like to have an outpatient induction of labour at home, please speak to your midwife about this at your 40-week appointment. Typically, women who are eligible for an outpatient induction at home are those women who have had a low-risk pregnancy, and the reason for their induction is usually because they've gone overdue past 41 weeks. If it is planned for you to have an outpatient induction of labour, you will initially be advised to come into hospital to have the initial assessments done and the initial monitoring of the baby and the ProPes inserted. Once everything has been done, you will be advised to go home, and you will be given information on when to call us back at the hospital or when to come into hospital if things are developing and changing at home. Okay, so now we're at the point where we can hopefully artificially break your waters. This will be done in a labour room with one-to-one care with your midwife. Once we have artificially broken your waters, we always give you a period of time so that you can mobilise and we can observe contractions. Induction of labour can also involve a synthetic hormone drip called oxytocin. Oxytocin is a hormone that you naturally make within your body. However, the synthetic version is commonly used in the induction process to help regulate your contractions in the hope that your cervix will dilate and labour will progress. If this is a process that is recommended to you, you will have an opportunity to discuss this with your midwife and your consultant at the time. There are some cases at the end of pregnancy where your waters will break before your body goes into labour. If this happens, you will be asked to come into hospital for an assessment so that we can confirm whether this has happened or not. If it is confirmed that your membranes have ruptured, your midwife will offer you an induction of labour at the time. However, evidence does tell us that 60% of women go into spontaneous labour following their waters breaking naturally. So if immediate induction of labour is something that you don't want, we will also recommend an induction of labour 24 hours after the time that your waters 24 hours is passed. We will invite you back into hospital and do an initial assessment of you. If your midwife finds that you're not in established labour at this point, it is recommended that you have induction of labour via the synthetic oxytocin drip, as evidence shows us that this decreases the risk of infection for you and your baby.